Listen, we're one of the largest healthcare organizations globally. They are a small group of startup outsiders who know nothing about the healthcare industry. They're just a group of retailers making noise in the market.
But look, my market research shows the complete opposite.
Hi, Anna. What's this? Who sent it?
Your solutions partner did. The messenger said it would be very useful.
Thanks. Look, I know you're my CFO, but you need to get your data right. I want another opinion from someone other than finance. There's no way this information can be correct. I know the competition. Hello?
Hi, Karen. If I may, I can explain everything.
Who are you?
My name is Entity. I will be your guide here.
But how did I get here?
Do you see, Karen? Right now, you are sitting in your office. All this is nothing more than a virtual simulation. I created it to help you evaluate the past and more accurately see the future. Otherwise, your company will disappear in the next few years.
This is about my company. Hold up. I need to feel we have the situation covered. Maybe now we're going through a rough patch, but I'm sure everything will end up working itself out.
No, it will not.
What? Explain yourself, please.
I will do better than that. Are you ready to experience the future of the healthcare industry?
Yes.
The healthcare sector is about to be hacked.
Hacked? By who?
While large organizations are relaxing, believing their foundations are solid, a legion of adjacent disruptors from other industries are ready to change things forever.
They're nimble. And they're targeting the niche markets.
Hundreds of new players are coming, and your profits are their opportunity. The gaps in your market are their entry points. These are now your real competitors.
But despite them, this year, my company launched the new innovation center that helped boost our revenues. You're not telling me anything I don't already know.
But what is coming is something totally different. When this smart revolution ends, 6 out of every 10 hospitals will morph into urgent care, retail, or a virtual health entity. 6 out of 10.
That would be a massive change.
Karen, you are looking at a key moment in the history of medicine. Frank Rossetti, a player on the MIT Engineers University team, will get a spinal cord injury in the middle of the game.
Oof. That looks nasty.
On that very day, his classmates will organize a cyber campaign for research and new therapies for Rossetti. Frank Rossetti will be the first person in the world to recover from an injury thanks to regenerative medicine. Later, the Nobel Prize for Medicine will be awarded to an artificial intelligence creation called Dinah. Dinah will be the one who cures the greatest enemy of humanity, cancer. It's Dinah's processing and deep learning that will find a cure for cancer by cross-referencing billions of online digital records, DNA samples, and healthcare data.
That's billions upon billions of processes. Then we can do anything.
Thanks to deep learning in genomics, the acceptance rate for transplants will rise to 90%. Personalized medication will be quickly and easily designed for each individual patient.
"3D printers."
Not only this, in fact, this device is an on-demand pharmaceutical 3D printer. In the future, the DNA sequence for every person will be available to doctors and lab techs so they can quickly find any anomaly and generate the prescription to cure and fix it. People will then be able to print their personalized medication at home.
It's like science fiction.
And yet, it is only science, without the fiction. Do you know what the greatest challenge will be?
Honestly, my mind boggles with the possibilities. Why don't you show me?
In just a few years, more than 2 billion human genome sequences will be stored. This will grow by more than 40 exabytes of data each year. All this health data will be stored and virtualized in huge data centers around the world.
Our biggest challenge will be finding the investment for all this technology. A hospital. I want to see what a hospital of the future looks like. And this is supposed to be a successful hospital. It's very small and looks empty. Things can't be going well when there's no one in the waiting room. What's going on?
The healthcare industry paradigm has changed radically. Healthcare is no longer about treating a patient when that person falls ill, but instead, it's all about monitoring and preventing illnesses before they have a chance to develop.
Where are all the patients?
Most of them are at home. This is the best way to treat them in the safest, most effective, and least costly venue. This way also has the least emotional impact on the daily life of elderly people. Look, Karen. In the future, each person will have a complete electronic medical record that will contain all the person's details, genetic background, habits, diet, even the percentage of cancer-causing agents the person is exposed to. But this opens up yet more challenges for you.
You mean hackers?
To protect all this information requires the greatest advances in cybersecurity. If someone develops a disease when traveling, their EMR will be shared instantly with the medical staff at that person's destination. Doctors can even perform remote surgery from another country. This will change travel insurance forever.
Okay. So if I start gathering all this data and information together,
your company will usher in the era of true predictive medicine.
predictive, as if you could see the future.
Thanks to deep learning algorithms, it will be possible to prevent hundreds of illnesses. Imagine being able to predict an outbreak of malaria in Africa so it can be stopped in time. The progress made with the Internet of Things is going to be essential for this health revolution. It will be possible to continuously monitor each patient using sensor technology. For example, right now, IoT technology is looking for software updates for Albert's digital pacemaker.
I understand. If we're continuously monitoring biometric signs, we can deal with a heart attack before it even happens.
Yes, Karen. There will be a shift in social paradigm. People will become more aware of their health and the importance of healthy life habits. New technologies will play a key role. They will create tailored exercise plans and help to improve people's diets. Insurers will also adapt to this situation. Individuals making healthy choices will pay less for medical insurance. The other great revolution will be the reality of true virtual care.
I get it. The key word is efficiency, which reduces visits to the doctor, which leads to less surgical intervention. Efficiency, which reduces staff costs and patient numbers. But what happens if there's a real emergency?
This is what happens when there is an emergency.
This is supposed to be an emergency. They look healthy to me.
Excuse me, but sensors have detected something unusual on Mr. Williams' biosignals. How are you feeling right now, sir?
Well, the truth is, my arm is starting to feel a bit strange.
Does it feel numb?
Yes, it will be fine if I sit.
Doctor, what is happening?
Your husband is suffering a heart attack, but please don't panic. Right now, an ambulance is right on his way, and a medical AED drone has been dispatched. Please, follow the instructions on the drone.
He's gonna be okay, right, Entity?
According to my data, he makes a full recovery. Don't you recognize where you are?
This is where our flagship office once stood.
Exactly. Most of the companies involved in healthcare are bound to vanish. And if you don't listen to what I've shown you, yours will be one of them.
Not on my watch. Entity, can I go back to my time now?
Of course, Karen.
Before I go, Entity, thanks for waking me up.
Hello, Karen. Welcome to the present.
Today, healthcare companies do not have the technology needed to face the changes. Many patients' experiences start in the acute care facilities. They will say that acute care facilities are going away. They aren't. That's where the story begins. That's where patients begin to realize that they need to engage in their own care. So when you build a new hospital, for sure it's great. But when you have an older hospital, you have to revamp all of that technology. That's why it's important at the get-go to build the facility right and to bring in the technology early on.
What are the drivers of these changes?
The main drivers in healthcare and transforming the patient experience comes around the ability to have healthy populations instead of population health. We need to be in the community and we need to engage with the patient in a way that they own their healthcare.
Are we going to prolong life or eliminate illness?
It's a great question, whether you should elongate life or eliminate illness. Having had the experience with lots of friends and family members, I would say that we eliminate the illness. When you eliminate the illness, it then elongates the life, and eliminating the illness helps everyone altogether. We have better research on diet and on stress. What we really need to focus on is mental health in the future, but with that, we start to eliminate illness.
I think one of the really important milestones that we reached as a society is to get rid of pre-existing conditions and to make it possible that every member could be insured one way or the other. But we have a whole new cascade of technology coming toward us. What are we doing about that? Just not only as Harvard Pilgrim, the local business, but as a society overall.
What are the main challenges?
One of the biggest challenges that we have is that, in general, health insurance, and to some extent health, is a low interest category. And I would just use as an example, people buy health insurance, but they don't really know what that means. If we look at the experiences of members buying insurance through the exchanges, we know that what they're looking at is typically what their premium is, and maybe they're looking at what their deductible is, but they're not really looking at their total out-of-pocket exposure. And they don't understand how their benefits work. And this is a real challenge that we are going to tackle head-on a go-forward basis.
Technology is key in this new era of healthcare. How will it affect the industry of medicine? Are we going to prolong life or eliminate illness? In the end, it's all about the patient, right?
So as we look forward, I would agree people are living longer. Technology continues to evolve. There's more that we can do with that technology. I put pharma in that same category. Those are costs that just are additive. And I think what we need to figure out is, well, what are we doing on the other side to control costs? What are the things that could be done that aren't being done? And in those categories, I would put things like telemedicine, appropriate level of service center and care. You know, if I were a young parent today and I could use technology to look into my kid's ear when they're screaming at 2 o'clock in the morning and know that they have an earache, or I could follow a protocol like they're working on at Children's Hospital to figure out when I should really take the baby to the hospital, those are things that could dramatically reduce cost on the other side. So I think this is really a balancing act. One side of cost is definitely going to continue to increase. We want the best technology. We want access to the best care. But on the other side, we really need to think about the appropriate provision and site of service for the care that's needed. And I think that technology could make a significant improvement to ensuring the appropriateness of those things.
Patients and doctor, instead of an expert and someone listening, they're really going to be peers. They're going to work together and partners so that we can really be authentic in the conversations. Sometimes I don't think we tell our doctors everything we need to do. You know, we fib, oh, I didn't eat those chips, or maybe I'm not smoking when I really am. So for us, since I believe that chronic conditions are really the problems we're going to have to solve in the future, if we aren't honest with ourselves, if we're not honest with our provider, we're not going to be able to make the health changes that we need to so that we can live a healthier life.
Do you believe that telemedicine is a real solution to the problems that we face?
I think telemedicine will come to being. Maybe a little bit longer than we currently have hoped. I know that there have been telemedicine trials for the past 5 years, but as our Skype and our Facebook and all the videos, the quality of the video improves, so will these interactions. So one of the struggles that we've had was, can you really see rashes and conditions and those kind of dimensions that you need in telemedicine? As that video improves, so will the ability to do telemedicine. I think in psychology and those areas, we're already seeing great strides, and as we get closer, as tests evolve too, that will make a difference.
If so, what's going to happen to hospitals and care centers? Do you think more care will be provided in the home?
I think we're going to see a lot less visits to the doctor as telemedicine, as the way we can test patients a lot easier, that they can have home tests. We're already seeing more and more home tests. As those testing and diagnosis mechanisms improve, we will see more patients doing those types of tests in their home, and we'll see less visits. And the visits that we see will be for larger, newer diagnoses, or as well as surgical procedures that we might not want to do at home for sanitary or complication reasons.